Newsnight, and tonight we are taking time to focus on the Kenya Demographic Health Survey. We've talked quite a bit about that with my guest. We have the Director General of the National Council for Population Development, Dr. Muhammad Sheikh, still here with us. We've got MacDonald Obudo, who's the Director General of the Kenya National Bureau of Statistics, and Dr. Patrick Moth, the Director General of the Ministry of Health. In the interest of time, I won't read all the questions, but these are some that are coming in. Abdul from Kendu Bay says, on the issue of the insurance cover, if NHIF, if the monthly fee can be adjusted, all who cannot afford right now will be able to afford and to have NHIF. I think Dr. Moth had said something about that, but he can also respond to that as we continue. Someone here says, please let them tell us the basis and reasons of getting data on number of sexual partners one has in counties. We want to understand this. And so I think, Bwana MacDonald, you're the one fielding some of the hard questions today. You'll be able to mention that as well. Hamala Levi Simiyu from Ngwelo. This is in Bungoma County. You're saying you're following the show vigilantly. What is the impact of the statistics under women and sexual harassment? They want to know that as well. Somebody here says, good news, our population is declining, well, not going down, but sort of under control. However, he's concerned that in certain areas, that is still not the case. And I think you mentioned it. What do we do about this? Those are some of the questions, and I'll read others even as we continue. But MacDonald, maybe you have the first chance to respond to this, even as you give us a bigger understanding of the implementation process of this survey, the challenges that you may have experienced. I imagine it wasn't all smooth sailing, and how you mitigated them.
Yeah, thank you. In terms of the challenges that we face as we are planning for the survey or undertaking the survey, one was actually on resources, which then I mentioned, and of course we were able to pull through it from the support of heavy support of the development partners. And actually, just while on that, I could mention, because Kenyans really need to know who have supported the survey. We have USAID that has supported has given the bigger chunk of the resources. We have the UN families, where we have UN Women, we have UNICEF, UNFPA. You have I've talked of UNICEF, UNFPA, UN Women, UNAIDS. Under the umbrella of the resident coordinator, UN coordinator, they really gave a lot of support. We have the Nutrition International. We have a World Food Program. We have the WHO. We have Bill and Melinda Gates Foundation. We have actually, there are quite a number of partners that came together to pool resources so that we could do this. So that is, they were able to help. Of course, there's a part that the government also played in terms of providing financial resources. So they were able now to bail us out to deal with one of the challenges that we had at the time. The second thing was to rush again and do the survey before the election, because survey required like almost 6 months. And when you look at the planning and the training programs, which were extended to 28 days, we were eating into the time that we would get into the field. And the alternative was to add more numbers, more teams, which then means that we needed to have more transport, which was, again, just going to be another problem. But we were able to pull through that by teams working hard to ensure that the survey was conducted within 5 months. That gave us room, and we ended it on 17th of July. Now, that gave us room to be out of the field as the campaigns for the elections were ongoing. Now, you've talked of, there's a question that is asking why we get into the element of the sexual partners. This is a demographic and health survey. Sexual activities are actually part of that process, which we cannot wish away. When you talk of HIV, you are talking of, you'll be talking of the protective measures and the like. You want to look at the behavior of the population when it comes to sexual activities. And so that question becomes very, very crucial. And you'll be able to see where religion plays a bigger part of the societal culture, like in the northern part of the country, particularly northeastern. You'll realize that HIV prevalence is very low and almost getting to nil, if you look at the KenFIA of 2018. And so we, when we are bringing on some of these factors, it is there to help us explain the anomalies that we are seeing. For example, when you get back to that report of the KenFIA, you'll be able to see that the national average for HIV prevalence was 4.9%. But Nyanza itself, the Nyanza counties are having as high as 19.5%. Now, that means there is something that is causing that in that region, and it's something to do with cultural behavior that you want to dig deep into. So some of these questions, when we bring them on board, they are helping us understand what the statistics are showing. You remember, we are now asking ourselves that why Meru on this, why not this other place? And if you look at it deeply, there are those variables that will help you understand why the results are the way they come out. So it is just normal, and it is not meant to embarrass anybody.
There is no sinister motive.
No.
That's what they wanted to know. No. Dr. Sheikh, we don't want to finish this discussion without talking a bit about female genital mutilation, which was covered, I believe, towards the tail end of the particular report. What do the findings in regards to that tell us?
So on FGM, female genital mutilation, I think there's a government directive to end this by 2022. Mm-hmm. And I think many of the partners were concerned whether this is possible. So I met this morning, the CEO, and she was a bit happy that at least we were able to reduce these figures from as high as 21 to 15%. This was a campaign that was conducted, in the last 5 years, and there's an act of parliament to end this. It is a cultural practice that is really practiced across the country. There are various views, but what we're just saying is that as a government, I think we have made progress in terms of ending female genital mutilation. And the focus now is just to focus specifically, there's something we call incidence and prevalence. If you look at the figures that was presented today, those who are aged below 10, have a lesser, are undergoing, less female genital mutilation compared to those who are above 35 and 40 and 49. So it means that the prevalence of it is still there, but I think the incidence of female genital mutilation has gone down, and it's because of the investment and the aggressive campaign that was done by the government in the last couple of years. But coming back to I think why this question of the number of sexual partners numbers, I think it's a very important question for the HIV and STIs, the sexual transmitted diseases, just to find out, because these are some of the factors that contribute, to this kind of infection. So I think that's why that question was specifically asked, just to find out. It's because some of those diseases are behavioral driven, infections.
Okay, thank you for putting that particular matter to rest. Dr. Moth, the question of stunting and child mortality, what does the data tell us in regards to those two?
Again, significant progress from 2014 Kenya Demographic Health Survey. Infant mortality has reduced, under 5 mortality has reduced, and also stunting rates have reduced. Therefore, children born during this period, at least, many of them can be able to achieve their full cognitive potential. Mm-hmm. And again, the national averages mask what is happening at the subnational level. So you'll find disparities between counties to counties. And that is what we need to do, a deep dive, and be able to find out what are some of the causes or what are some of the drivers of stunting. How come certain counties are not making that significant progress? And therefore, we need to do a deep dive to be able to design interventions to be able to let them also move at the same pace with the rest of the country.
Okay, thank you so much for that. Oh, say something. Go ahead, jump in.
I think what Dr. Moth, the issue of neonatal mortality. If you look at the figures, we reduced from 22 to 21. And this is just something, that is really a very stubborn indicator that's not moving, And this is, the proportion of children who are dying, before the age of, 1
month.
1 month. Mm-hmm. And if you look at that, it shows, the quality of our healthcare. That they're dying within, the period of, either within the facility or just within, the postnatal period. So I think it's an area that really we need to focus on how we can reduce our target, as within, the SDGs is to reduce these figures to around 12 per 1,000 live births. So again, it's a figure I think we just need to put a lot of investment and a lot of focus, especially the neonatal mortality. If you look at the under 5 mortality, which has moved from, I think, 54 to around 42. Again, that's is a good progress. I think our children are really enjoying, and going up to their 5th birthday and enjoying, that is again a progress. But we need to focus on the neonatal mortality, which shows the quality of healthcare in our facility.
Okay. I think at some point we will have to get some final thoughts, but okay, go ahead. Yes,
I think that is a very important indicator, which is usually forgotten because of nobody speaks for the neonates. And thanks, Dr. Sheikh, for bringing it up. It's actually a measure of what happens during the process of delivery or childbirth and the immediate postpartum period. So to add on to this is just not a question of the numbers in terms of the progresses that we have made in various spheres, but also to look at quality, because we should not just look at the absolute numbers that you deliver in healthcare. What kind of outcome did you have out of that delivery? Is it a quality baby who scored very, very well, will be able to achieve his or her full potential, or is a baby who is born in a facility, but because of the interventions undertaken in the facility, then the child will not be able to achieve his or her full potential. So quality becomes paramount. In terms of the progress that we have made in numbers, now we need to do a deep dive into the quality of what comes out of all these entire processes.
Okay, a lot more work clearly still needs to be done. I want to give each of you a chance to give your final thoughts. Anything that you'd like us to conclude this with, just help our viewers think through what happens next after all this amazing data has been made available to the public. And for you, Bwana Obudo, even as you do that, let's talk about the question of home ownership. Anything interesting that came out of that, either on the men's side or the women's side? That was some data that people were discussing today in a forum that I was in. Yeah,
there is a considerable percentage of women now owning homes, which is a very big plus. But it could also mean that you don't look at that one on its own, but you also want to look at it in terms of marriage too. That those who are owning their homes, are they in marriage or on their own? Because men now tend to own everything, even if the resources are coming from the female side. So I think we'll need to look at it in a more deeper way and see and bring on board the other factors, just to be sure that when we talk of progress being made in that area, then it is not something that I mean, it's very clear that men have given freedom to women also to own property the right way, because that is actually very, very healthy. But one thing I'm happy about is that there is quite an improvement on that. My last appeal, I would wish that Kenyans use the numbers that we have given in a very positive way, so that we are able to make progress, and more so to the county government. We have, this survey is too expensive. It's very expensive just because we are trying to get county level data, which is meant to be very beneficial to the county governments, because health is devolved. And so there is need for a lot of statistics at the county level. And I would also wish that counties come out to work very closely with the Bureau of Statistics. We have a number of areas that we need to collaborate in. When they are coming up with the county integrated development plans, they require a lot of statistics. And that statistics is easily generated at the county level through what we call the county statistical abstract, which then all counties really need to generate. And Bureau is there to support. I wish we could all come together and do that under one roof, so that all the counties will be having the report. But all the same, for the purposes of the DHS, we are planning to roll out a further dissemination at the county level with a lot of data 3 months later, once we get that one, so that we are able now to focus on county by county, giving their details of what comes out of that process. As we are planning to do that, what has already been made available should be put into good use. Thank you.
Thank you. Thank you so much for that, Bwana Obudo. Let's hear from you, Dr. Muhammad Sheikh, even as you give us your parting shot.
From my side, I think as a country we have made progress, but not enough progress. I think there's still a lot of heavy lifting to be done. in terms of our demographic indicators, especially, the child health indicators, the maternal health indicators. We have done very well in terms of the family planning program, I think, but still we need to do a lot of investment. Our target, we look at our fertility, which we have not shared, the contraceptive prevalence in this country is around 63% for all commodities. But we want to reach that target to 76 so that people can make, can space their family and can have, planned, family, proper family spacing. But what I'm just saying is that we just need to do a lot of heavy lifting as we move forward. In terms of population, really we are at that crucial stage, what we call in population terms, there's something called the demographic momentum or the demographic transition. We are having very youthful population. More than 75% of our population is below the age of 35 years. It's a very dynamic, very aggressive group of population. But this is the age group that's really supposed to do heavy lifting. There is something they call accelerated economic development in the Asian tigers. Most of the time we compare ourselves with the Asian tigers. But what have they done in that short period, in 20 or 30 years? What they did was just, that population was skilled, was trained, and they did heavy lifting in that short period. Compared to the Western countries where, they did this development, they reached as a developing nation, it took them 200 years. So as a country, I think this is opportunity, this is a time as a nation, as a people, to do the heavy lifting so that in the next 20, 30 years, we can enjoy the fruits of investment. Thank you very much.
Okay, thank you so much for that. And Dr. Patrick Moth, what's your parting shot on this?
My shot, of course, is significant progress has been made. But now, beyond the numbers, we need to be able to look at the quality of the services that we provide in the entire spectrum of things. For the counties, I think it's a bit of introspection. Look at how you have performed as a county compared to the national figures that have been released in this report. I think it's a good platform because new administration in the counties have just come in 3 months down the line. And this, therefore, becomes your benchmark to be able to see where you want to be able to take your county in the next 5 years. By the time you do the 2027 survey, then we should be able to flip things and change those figures so that those who are lagging behind are in tandem with the rest of the country.
Thank you so much, Dr. Patrick Moth. And before you go, Daktari, I have one last question which has just come in. Someone says here, no name, Wahiga, please ask Dr. Moth. We have lately seen some screaming headlines in our local newspapers about a new strain of STI. In fact, one paper splashed the word supergonorrhea and it went almost viral. Can he shed light on the veracity of this information and what measures the ministry is putting to sensitize the public should it be true about the same, Daktari?
This report came from a study that was conducted by Cambridge amongst commercial sex workers. And out of the pathogens that they looked at was, of course, Neisseria gonorrhea, the organism that causes gonorrhea infection. And out of that, there are quite a number of pathogens which were resistant to ordinary antibiotics. And in one particular individual, out of a sample, I think, of about 400, was one which was resistant to nearly all the antibiotics that we put it through. Cambridge is doing a deep dive into this to be able to inform us further the spread and span of this particular strain of gonorrhea. And once we have that information, we'll be able to put in place the appropriate interventions to forestall.
Because there were questions about whether it was new data or very old data that had simply been...
It is slightly old data, but even if it's old data, it's still very, very pertinent.
Valid.
Yes, because this has also been reported in other jurisdictions. We have had reports from Japan, we have reports from Thailand, we have reports from UK. So we are not an isolated community, and therefore we need to be able to take it seriously. And of course, going forward, of course, to be able to take into consideration the necessary preventive or protective measures to be able to ensure that you are not exposed to that kind of infection by using the necessary protection, including use of condoms, and reducing the number of sexual partners based on the report that you have just shared.
I think that's a good place to leave it. Dr. Patrick Moth, Director General, Ministry of Health, thank you for your time this evening. McDonald Obudo, Director General, Kenya National Bureau of Statistics, asante sana. And of course, we've had Dr. Muhammad Sheikh, Director General, National Council for Population Development, joining us to unpack a report with some data, very interesting, showing what's happening around the country. Over the next couple of days here at the Raw Media Services, we will have various experts on different shows, some of you might actually be here back soon, as soon as tomorrow, to help viewers understand and listeners in different languages what the data actually means. And in 3 months, we are told a bigger report, more in-depth, will be available for public consumption, and we'll see if we can get some of these gentlemen back here to understand what some of that data actually tells us about the why, not just the what. Thank you so much, gentlemen. Thank you for everyone who's tuned in for this broadcast. You know, this is what we try to do here on Newsnight, get decision makers, duty bearers to answer some of the questions you may have. We certainly hope we have shed light on some of the questions you may have had about this particular survey. But this is where we conclude it. On behalf of the whole team that's made this broadcast possible this evening, and together with my sign language interpreter who's been, we've been working together, Wilson Mushora, this is where we leave it. Have a good